So today we will learn about asphyxia. So what is asphyxia? Asphyxia is exclusion of air from the lungs. So we remove the air from the lungs, and there are two basic mechanisms to remove the air from the lungs. We have constricting force around the neck, constricting force around the neck, which can be the force can be the force is the weight of the body, or it can be other external force. So when the force is the weight of the body and the weight of the body is completely put on the neck, it is called complete hanging. So over here we have the complete hanging. And when the complete hanging is there, obviously there is no part of the body that touches any surface. So the force completely exerted on the neck. Incomplete hanging is that some part of the body touches the ground. Hanging can be typical as well as atypical. Typical hanging, the knot is present on the occiput of the person, while atypical is any other place. Constricting force around the neck, when it is not the weight of the body and any other external force, it is called strangulation. Mugging is when the bend of the elbow is placed on the person's neck and his money is stolen, so it is mugging. Throttling is manually strangulating a person with hands. Suffocation is an external factor which is causing exclusion of air. It can be smothering when external orifices are blocked, gagging when a foreign object is blocking the mouth and the nasopharynx, allowing the person not to breathe. Choking is when the foreign body is placed in the trachea. The person choked while eating food in the restaurant. And there is traumatic asphyxia when the building falls on the chest of the patient and he is not able to breathe because the chest cannot expand. So here we will deal mostly on the constricting force around the neck part. So we have the constricting force on the neck part. So when the weight is 2 kgs or the force is 20 newtons, so the force we have the compression of the jugular vein. When the force is 50 newtons, we have carotid artery. When the force is 150 newtons, the trachea gets compressed, and when the force is 200 newtons, the vertebral artery get compressed. And now we will compare the hanging and strangulation part over here. Hanging is suicidal while strangulation is homicidal. Ligature mark in hanging is oblique and it vanishes at the point of the knot due to the suspension of the knot, and it is above the thyroid cartilage, while strangulation is transverse with a complete ligature mark and below the thyroid cartilage. But if ligature is not used, there is throttling with six-penny bruises and crescentic abrasions. Crescentic abrasions due to the nails. We have saliva dripping out of the mouth in the hanging, antebottom hanging, while in strangulation the saliva is absent. Carotid artery tears are quite common in hanging, while the tongue protrusion and fractures are more common in strangulation, which are outward compression fractures, while in hanging there are inward at least one component which is present and fractured inwards. So the carotid artery is compressed in complete hanging, while in incomplete hanging the picture is more towards the strangulation in this chart over here, this place, because the force is not sufficient. So if the force is large, if the strangulating force is large, the carotid artery get compressed as we have seen over here, and there is no congestion fatigue. But if the force is less than 50 newtons in incomplete hanging, because the whole weight of the body is not there, or in the strangulation, Only the jugular vein is getting compressed. Only the jugular vein is getting compressed, and there is facial congestion and fatigue. Surest sign of antepartum hanging is dribbling of saliva, and there is something else. The laugh faces sympathetic way, which is due to compression of the cervical sympathetic chain, which causes ipsilateral eye opening and mydriasis, just like a stimulation of the sympathetic part. Overstretching of the spine causes hemorrhage, and this concludes our constricting force on the neck, which we wanted to discuss.